Facial hair is a natural phenomenon with men, which is indicative of their natural evolution through puberty into adulthood. But with women, it is perceived as abnormal. Science explains that when a woman has excess facial hair, it is symptomatic of a medical condition known as Polycystic Ovary Syndrome, PCOS. Simply put, it is a condition where there is an excess of male hormones, a disorder which affects a woman's reproductive system, causing infrequent or prolonged menstrual periods.
The hallmark of the PCOS is excessive production of the male hormone testosterone, and that is what is responsible for most of the signs and the symptoms that people see. So one of the prominent signs and symptoms is excessive growth of facial hair. So you see a female having hairs like myself, the chin, the sideburns, the chest, and the tummy. But I think at this point I should say that it's not everyone that has those abnormal facial hair that has polycystic ovarian syndrome. See, apart from that hair growth, you can see pimples, which is called acne. Then other things such as abnormal periods. So a kind of period that you cannot really time, you can't predict the regularity of your period, or the period is not even coming at all. This is also a symptom of polycystic ovarian syndrome.
Not entirely surprising, most women who have excess facial hair or irregular periods do not know about their condition.
Okay, well, for me, I have irregular periods. My periods are usually long, and I just thought it was okay because normally it's okay for women to have longer periods. But now that you've mentioned PCOS, it's likely that it could be related.
No, I had no idea what PCOS meant.
No, I don't know what PCOS means. I've never heard of PCOS.
I didn't know that having regular periods or having excess facial hair is a symptom of PCOS.
PCOS cannot be cured, but the good news is it can be managed. Early diagnosis and treatment will prevent possible complications ranging from type 2 diabetes to heart disease, infertility, miscarriage, and even cancer.
These are interwoven. That's why if you have a patient with diabetes, you want to screen for the level of cholesterol. You want to keep an eye on his or her blood pressure because they interrelate. It's a metabolic disorder. And so because of this hormonal disorder, any of this can come into being. You need to also understand that it doesn't mean that every patient with PCOS will develop all of these complications. No. What happens oftentimes is that if a patient has polycystic ovarian syndrome, we counsel the patient to monitor these parameters. The patient should have a regular check of the sugar. In fact, we do a fasting blood sugar, and at times we do what we call the glucose tolerance test to see how well the body can tolerate sugar. But the problem comes when the person becomes nonchalant and it doesn't give any check to any of these parameters.
Weight loss and some other recommendations or prescriptions by the doctor based on the type of the woman's PCOS can help to manage the hormonal imbalance.
The women losing weight helps to improve their symptoms. For example, those with irregular periods, by the time the woman starts losing weight, you will notice that those symptoms are regressing without using any medical therapy.
So the patient may say, how is she going to achieve this? One of the ways to achieve this is by visiting your dietitian.
Medical science says that most PCOS cases are hereditary, making prevention a bit complex. Habibat Olawan, AIT News, Abuja.